Hey everyone, it's Monday, right,
It's
Kristi?
Monday.
Dr. Melanie Palm, if you haven't met me before, this is Kristi Cashman.
Georgia,
Who insists on being on every single one of these streams because she's just a total ham.
That face.
I know, and you know, so we're going to talk a little bit. We're doing all these lunch and learns, so about once a week we thought let's kind of share the latest and greatest. And so there's been a couple of topical things I think within sort of muscle toning that I think that's what we wanted to focus on today.
Absolutely.
Right, Kristi?
Yes.
Including just this month, hot off the presses.
Yes.
There are some new clearances, and I've made mention of this, but there are some actual new FDA clearances for Emsculpt, and I think this really sort of parlays into, yes, we do a lot of these procedures for the aesthetic benefits, getting better abs, getting a little perkier tushy, you know, but a lot of what our patients comment on, and I think as much of a reason for them doing it is strength of their muscles and sort of overall health of their body.
The
so
overall wellness.
according to this new press release that was just released, you know, about in the last week, there are new indications for Emsculpt Neo. So if you're not familiar, Emsculpt Neo, you want to explain what technology it is?
It is a high fem technology, which is sort of a magnetic muscle stimulator for different groups of muscles. We can treat about 10 different areas of the body, and so it's going to strengthen your muscles as well as using radio frequency to help to warm your muscles up, to help to remove subcutaneous fatty tissue, and also can warm the skin to help create collagen, elastin, and hyaluronic acid.
Yeah. So what are the percentages? It's like regardless of body area that we're treating, what muscle group we're treating, abdomen, or if we're doing arms or inner thigh, what are the percentages in terms of fat loss, muscle gain?
Fat loss is about 30%. Fat loss is what they see. They see is a 25% of increase in muscle mass. And then there's also studies about
looking at diet, stasis recti.
Exactly,
which is a separation of the rectus abdominis muscles. So those, you know, what gives us our 6-pack or 8-pack or 12-pack, whatever pack you're getting. There's a separation of that when women are pregnant. You know, there's a lot of pressure on the developing uterus and the baby inside, and so that puts pressure on the muscles, and they do stretch to a certain amount, and they oftentimes in women don't completely revert back to that original. So you have more of a space between those two vertical lines of the muscles that are our rectus abdominis muscles. So in a study looking at treating Emsculpt Neo in the abdominal area, there was a 19% decrease in the width of the diastasis recti. So I think really important for function, right?
Absolutely. Just keeping that core strong, pulling that abdominal region in. In fact, I have pictures of a beautiful result from a patient who did a series on her abdomen after having her baby, and it was just phenomenal. The amount of strength that she felt in order to be able to work out even harder. So I think it's kind of it just works. They work together. You definitely get a good look, but you also get more strength in order to continue to improve your workouts.
And we've talked about this concept of sarcopenia, which is, you know, muscle mass loss through the decades. And so similar to we have osteopenia and osteoporosis, looking at bone mineralization and the strength of our bones. And we do things like DEXA scans to sort of see where women are doing in terms of their bone mineralization and the strength of their bones. There is an equivalent with muscle. And so there's a concept of sarcopenia, which is this loss of muscle mass over time. And when we lose enough muscle mass, we don't function as well. Our proprioception, so our ability to sense where joints are in areas is not as attuned, our sense of balance can be
huge,
off.
yeah.
So having a strong core and making sure that large muscle groups are maintained over time. Yes, it's important diet and exercise. It's really important to do muscle strength training, but this is something that super physiologically we can train muscles and build muscle, both hypertrophy and hyperplasia. So we're not only making existing muscle cells plumper, but we're also building new muscle cells, which is very, very nice and great concept. And we want to actually see both, and these are backed by actual studies where we've labeled sort of sections of muscle cells and seen an increase in that activity. And so what I wanted to talk about is the FDA clearance, kind of leaning into that. So the company BTL, who's the manufacturer of Emsculpt Neo, said that there's now new clearances for this, and this includes prevention and retardation of disuse atrophy. So that just means the muscles aren't being used enough. This is going to help sort of reignite them a little bit. Muscle re-education, so the idea of muscle memory. I think that's a term like we talk about. That's basically addressing that. Maintaining or increasing range of motion, and I was talking to someone who's a big skier, and I anticipate doing this too. I try and do a little bit of that during winter timing. The quad muscles are so important for that. Your glute muscles, your ab muscles, core work, but also your leg muscles. I mean, that's something I will do to make sure that I'm in the best shape to try and mitigate having some sort of unfortunate accident while you're on the mountain. Immediate post-surgical prevention of calf muscles to prevent basically DVT.
Right.
Well, isn't that such an interesting thing?
So nice.
Yeah. So right now, currently, the convention in hospitals, and going back to my intern years, we used to have these calf stimulation and they basically were inflatable circumferential sort of pieces that went around your calf. They will also do things like heparin dosing, which is a medication that thins the blood if you're at risk of having a DVT, especially after surgery. But this is another way we can stimulate the muscles, because our calf muscles are so important to the circulation of what's going on. And when we have blood pooling in our veins, especially in our lower extremity, long flights, long car rides, immobilization from a surgery or hospitalization, we put ourselves at higher risk of developing blood clots. And they start in the veins, typically in our lower legs, and then can go to other areas and cause a stroke, can cause problems with breathing, something called a pulmonary embolism. So the idea that we have something that's muscle training again, but helping possibly prevent some of these DVTs, I think is really interesting. Relaxation of muscle spasms. Yeah,
that's huge too. For athletes who need a little bit of help after a hard workout.
And then increasing local blood circulation. Muscles are very vascular rich, and so if we are exercising this particular tissue group, of course we're going to help with circulation a little bit as well. So I think this is very exciting. I think, I tell patients oftentimes, whether it's muscle toning for our face with HIFS or if it's HIFM technology on our body, that I think of this as kind of physical therapy before and after things to maintain things, for facial muscles. I think it's kind of PT if you're considering facial surgery. And really, it's one of these things that we can help probably make the tissues stronger, more lubricated, a little bit healthier.
Yes, it's like building from the foundation up.
And then, after surgery, helping to sort of maintain those results. So I think this is very, very exciting. The potential for sort of targeting, I think, new patients is that we help with post-surgery and rehabilitation of patients, individuals seeking increased mobility and flexibility, active elderly patients that just want to keep their stamina up and really help, fight against this concept of sarcopenia. Recreational athletes that are aiming to prevent injury. So exactly what I was talking about, recreational skiing. And then professional athletes experience joint and muscle overload. I think just so important that the integrity and the physiology of our bodies are being maintained. So, with over 4 million treatments today with Emsculpt Neo, I think that this is a new avenue that just opens the floodgates to more opportunity, and I think leans into, yes, you've got aesthetic benefits, but really some of the functional benefits we're seeing from this as well. So tell us a little bit, what are you seeing in clinic in terms of areas people are really attuned to? I saw there was someone on your schedule today that it looked like we were treating a core muscle group. And
we do. A lot of patients are treating their core muscles to help with balance, to help with just strength overall, to help with back pain, keeping that whole core strong. It helps with back pain. I know that you like to do both, your opposing muscle groups, so the booty and the abs help with that lower back. I have patients doing their quads. I did my quads before walking miles in Italy. Yep. And I can say that it absolutely helped. Where I've done triceps, biceps recently. We do the waist where we get the obliques and pull that core in even tighter. So we can do many areas that help with different muscle groups.
And you've got maintenance packages kind of to help incentivize people to really sort of have an insurance policy and maintain some of the performance, but also aesthetic benefits surfacing for treatments, right?
Because you do want to, if you don't use it, you lose it kind of thing. So we do our initial series of 4, which come in once a week for 4 weeks, 30 minutes a piece. And then after that, we sort of tailor a little maintenance schedule for you. There are patients who come in every 3 months. A lot of patients come in every 3 months. I have some that come in every 4, and then I have a few that just do every 6. And that's just to keep those muscles, like you said, the muscle memory alive.
Because although we know from studies with 12-month follow-up without retreatment, you're maintaining a lot of that muscle mass. Like I noticed, I haven't treated my abs in probably about 3 months. And I just need to be better. Like you've been in the candy store and you get to the end of the day and you're not doing it. But I did yoga on Saturday and I noticed like holding planks.
Yep.
It almost feels like cheating when I had Emsculpt Neo recently. But it was kind of one of the signals. I was actually thinking about it this week and it's like, God, I need to get in and have Kristi, place me under Emsculpt Neo and do a little touch up because I think that would be really nice just as I anticipate going into sort of fall sports season.
Absolutely.
So, changing gears a little bit, we talked a lot about body with Emsculpt Neo for muscle toning and fat reduction and maybe even some, we know it builds collagen, elastin, may have some skin benefits as well, although the clearances really are for muscle toning and fat removal. Tell us a little bit like trends you're seeing with M-Face, because I was remarking to a patient that really had seen some information about it, wanted to talk to you, was coming in for a consult, and I was like, it is consistently one of the things I just see your schedule packed with.
Packed. I mean, that machine is going all day long. It's one of my absolute favorite treatments. I just love what it can do for somebody, the lift that it creates in the face. And so, we're seeing, anybody from in their 30s to I have a patient almost 80, and everyone is getting some sort of benefit from it, whether it's the muscles lifting, whether it's a little fat removal under the chin, an improvement to the skin itself. They're seeing all of that. I think that we make sure that we again tailor the treatments to the patient. So I definitely will take a look at the patient and see how many treatments they need. I would say on average, my patients get about 6 treatments. Anybody in their 30s, 40s can probably get away with 4. But anybody over that, we kind of tend to go for 6 treatments. I've just seen the best benefit with that. Also, kind of wanted to mention too that anything non-invasive, Emsculpt, M-Face, Cool Sculpting, any of our non-invasives, definitely take time to see your final results. So after your final treatment, you're going to want to wait at least 3 months to see your final result. You will see improvement before that most likely, but you're going to just continue to see improvement for the next 3 months. So I usually don't do my follow-up photos until about 3 months later just to see the real before and after. And that just means you want to schedule at a time that's best for you. So if you have an event coming up in the holidays, you want to get in now to see those results. And for summertime, you want to get in more in the spring to see the results by summer. So just want a little...
And that makes a lot of sense when we think of the mechanism of action of this, right?
It's biologic.
We're biologic, we're building muscle back, which is helping to lift vectors of the face. And so, that's not immediate.
Right,
and,
absolutely.
We need some time to respond to the treatment. So totally agree with that. Younger patients, we're treating more with 4. I would say most of our patients, I think the average age of our patient in our practice, last time we checked was 51,
right,
52,
that's
which is
yeah.
on point in terms of like sort of national averages of aesthetic patients. And those patients, I think, those of us in our sweet spot of 40s, 50s, 60s, especially if we've got a little more significant skin laxity, I think considering doing the 6 treatments, even though the clinical studies were based off of 4, just now having had 2 years of really robust use of this device in our practice, we're finding that that is a much more likely sort of outcome of really seeing significant results in terms of skin lifting. And so can you review kind of the areas that we can treat currently?
Absolutely. So there's 3 areas on the face that we can currently treat. We're treating the forehead, which lifts the frontalis muscle. We get a lot of beautiful just kind of opening up of this whole area, lift of the brows. We treat the cheek muscles. There's 3 groups of muscles in the cheeks, so we're lifting in the upward direction and also pulling back a bit as well, so patients see sort of a decrease in the hollowing under this, under their eyes with the lift here. You see a decrease in these lines in through here,
so
your
nasolabial folds.
Right. And then also a sharpening of the jawline with the cheeks. And then we have a new applicator that came about 6 months ago. That we treat under the chin here, and that applicator actually does 3 things. It's going to tighten this little muscle under here, this tiny little guy here, which holds everything up and back, and then it's also removing some subcutaneous fatty tissue under here, so if you have a little bit of extra under here, that's going to help in that area, and then again helping with the skin in this area with collagen and elastin production. So that one does 3 things.
And when we target the digastric muscles, which are these muscles that kind of help us bring up the floor of our mouth, and so it helps kind of with that cervical mental angle, that angle we see from the chin to our neck region, brings it closer to that sort of 90 degrees, which is super pretty. What does that feel like? Because here I've had forehead and I've had cheek done. I don't have as much of an issue here. So
I've done all of them.
Yeah, so tell us a little bit about what that's like.
So the forehead, for me, the forehead and the cheeks were the easiest. They were, it's just somebody, kind of moving
just kind
your
of
muscles.
Involuntarily like twitching a little bit.
And raising your eyebrows. Under here it's a little bit different because it's such a tiny little area. I think it feels a little more like a twist rather than a muscle contraction. So for me it was a little more uncomfortable, but definitely not painful in any way. It was just, you knew what was happening.
And that's what I hear, like a spiral twist.
Exactly.
Almost like if you think about taking a fork with some noodles and spaghetti, that sort of motion, just a little bit of a feel here. So none of it is painful, but this is, I've heard from patients, a little bit stronger if they've had cheek and they've had forehead treatment in the past, and that's a lot of our patients have been so happy with those areas of treatment. Once we have the submental applicator, they've been really interested in that. And I think what's really neat is continue to stay tuned, because I think we'll find there are other areas that we will continue to research and may have benefits beyond just doing the forehead, the cheek, and the chin. But I wanted to review some of the numbers, because I tell patients this all the time. I think when I lecture, I talk about this as well. I think part of our Hippocratic oath, when we take that oath as physicians, is if we are not an expert in something, it's part of our duty to help refer a patient elsewhere. And so I think it comes down to, well, what is an expert? And I think an expert is someone who understands the technology, understands physiologically what it's doing on the body, is attuned to sort of analyzing facial analysis, body analysis is so important in recommending a treatment plan, and then has a depth of knowledge and a length of time in treating it. And so I wanted to highlight you. I'm probably going to embarrass you a little bit, but we've had Emphase. We were one of the first here in California, and really one of the first in the nation to have Emphase. And it has been such a popular treatment as either a standalone in patients that truly want rejuvenation. They don't like the idea of an injectable. They want something else device-driven to help with sort of facial rejuvenation. But it's also been an amazing complement to, I think, our injectable practice. It's really great. I saw photos of someone, I've done some injectables, you've done some facial toning, and then you've done some fat reduction on this patient, and they look amazing. I mean, it just beautiful. And they, gender specific. I think that's so important when we're talking about technologies. 100%. This has pushed this male patient into very much more like what we see as male ideals of proportion, which I just love seeing that. But I wanted to highlight why I think we are, experts in this. It's the length and duration of time we've had it.
Absolutely.
And also to highlight some of the numbers just more recently since you've been at the practice. So looking at InFace, so if you look in California as a quarterly summary, kind of in the spring to summer time, the average number of treatments that a practice was doing was 35. You were completing 153. And, we talk about like tipping point with Malcolm Gladwell and 10,000 hours to become an expert.
Right.
And I think that really shows that, we are performing well and beyond, and Kristi in particular when it comes to InFace, because she's been handling a lot of the treatments over the past couple of years, she's exceptional at this because she's seen so many cases.
Yes, yeah.
And I think that is where you get somebody that has finesse in treatment, knows what to expect, really counsels patients accurately, and can be a driver in sort of getting the most ideal outcomes, and that trend has continued. So, in summertime, which is traditionally a slower time, so the California quarterly summary was 29 average treatments at a practice. We were doing 84. Wow. So I think that's pretty incredible numbers when we look at InFace. And, we see the same trends with body with Emsculpt Neo. So, during the summertime, traditionally a slower spot, we were right on par with treatments, that are occurring. And there's a lot of people that have Emsculpt. Or muscle toning devices, and so for us to be right there in the middle of the pack, I think says something. But during sort of early summer, we are even beating that. So 65 average treatments in California during the springtime, and 87 was what was going on here. So I think again that speaks to having really knowledgeable staff, including yourself as a non-invasive body contouring expert, it really matters.
It does. And I love to learn everything new that's coming out, including the, all of the newer studies. I love that.
Yeah.
I love being able to add
and I think that thirst of knowledge and curiosity, that's something that drives me as a board certified dermatologist, like never stop learning. I always want to be at the cusp of that. I think that's why we've been a part of more than 50 clinical trials with me as a principal investigator, why I continue to lecture nationally and internationally, because that puts us in this wonderful circle where I'm learning from peers, we're learning during research studies, where Kristi's a part of that, and I think it allows us to bring a really elevated level of care in terms of patient care.
Absolutely.
So I don't know if you have anything to add, but I wanted this to be a little brag corner for you. Because I think,
appreciate that.
Having been a patient myself of you and Ricky, I just think you're both outstanding. I mean, human beings, but providers, just really exceptional at what you do. And so that's why I think it's so nice for us to be able to have these little chats.
It's so fun,
Isn't it? I mean, honestly, it's a fun way for us to kind of spend some of our lunchtime. But
definitely.
Please let us know if you guys have topics that you want us to cover. We'll always try and do like me bringing up the press release. I think that was really timely and kind of going over some of the technology that's coming and on its way and tried and true. But with that, we will say goodbye. I'm going to turn it off myself since we're at lunchtime. But hope you guys all have a fantastic week.
Have a fabulous week, and we'll be talking to you soon.
All right. Bye, guys. See you next time.